Hi everybody, welcome to the Active Minds webinar. If I haven't had the pleasure of meeting you yet, my name is Taylor DeSico and I'm serving as the International President of CKI this year. So I'm going to quickly go over a few updates and then we're going to have Marky here do the Active Minds part of the evening, and then we'll play a Kahoot, and then if you stay on and do the survey at the end, one person will be selected at random to win a Kiwanis store gift card. So definitely stick around for that. Next slide. So just some updates. First of all, the Kiwanis Children's Fund scholarships, those applications are due February 1st. That's coming up in just 3 short days. So definitely apply for those. That is a great member benefit. March 4th, we have the virtual escape room event. Registration is now out for that. Madison, if you wouldn't mind linking that in the chat, that'd be great. And then March 25th is the Battle of the Bricks event. This is our big brick by brick fundraising event. We will release the registration to that later on. And then next, International Convention. This is the biggest takeaway I want you to take away from these updates is International Convention. It is June 25th to 27th in Pittsburgh, Pennsylvania. Early registration deadline is through March 31st, and the regular deadline is through May 23rd. Something we're doing new this year is we're giving out 5 International Convention scholarships, and the applications for those are due at noon Eastern Time on February 14th. And like I said, if you stick around for the end, one person from this call who fills out the survey will be chosen at random to win a Kiwanis store gift card. So moving on to the next part of the evening, joining us tonight from Active Minds is Marky Pasternak. As the Senior Manager of Higher Education at Active Minds, she has been overseeing Active Minds' work in higher education, focusing on mental health advocacy for college and university students, staff, and faculty for the past 3 years. Specifically, Marky leads Active Minds' new Mental Health Advocacy Institute, a leadership opportunity for college students wanting to learn how to be a campus mental health advocate. Marky received her bachelor's in psychology from Marquette University. During her time at Marquette, Marky served as a national Active Minds student leader. Marky then received her master's of science in higher education and student affairs from Indiana University Bloomington, and during this time, she worked for the Office of Student Activities. Before joining the Active Minds staff full-time, Marky worked at Auburn University for 3 years, focusing on mental health programming and peer health education, and was the co-advisor for the campus's Active Minds chapter. Marky, thank you so much for joining us tonight. I'm going to go ahead and pass it over to you.
Oh, Marky, we can't hear you.
Oh, so sorry about that. My bad. That's embarrassing. But hi, thank you for the lovely introduction, Taylor. That was wonderful. I really appreciate it. I'm going to share my screen so you all can see my slides. I'm super excited to be talking to you all today. As I believe Josh and Co know, I was the president of my Key Club back in the day in high school. So Kiwanis always has a special place in my heart. And I remember going to those conventions and sorry, I'm like talking at the same time. There we go. Going to those conventions was such a wonderful memory, and you all have such a great community. So I'm really excited to be here tonight. And as you heard in my bio too, you know, I was a national college student leader, so I understand where you all are coming from and the work that you do on your campuses and beyond your campuses too every day, and how dedicated you are. So thank you for what you're doing. It's really commendable. And I'm here today to give the presentation Mental Health 101. And what we're going to talk about today is really our partnership with you all. So Active Minds and Circle K. You know, who are we as an organization, Active Minds, and then give you some good tips on mental health, and I'll break down everything. So let's get started. I've got a lot of information to share today. So Active Minds, who's heard of Active Minds before? If everyone just wants to say in the chat where you go to school, and if you have an Active Minds chapter, Active Minds on your campus, or if you don't, that's okay. Love to learn about others and where others are coming from. In the chat, University of Alabama, yes, you do have one. Awesome. I can't say those other words, as people probably heard. I worked at Auburn in this bio. Okay, so not sure at the University of Nevada, Reno, but thank you, Lindsay. See anyone else? Just want to say even where you go to school, even if you don't know if you have an Active Minds chapter, that's okay. All Right. Well, we'll wait for those to come on in. But for those of you who haven't heard of Active Minds is the nation's leading nonprofit organization focusing on changing the culture around mental health through mobilizing young adults, youth and young adults. So we are in colleges and universities in addition to high schools and middle schools, just like Kiwanis, right, has those different kind of sectors. Active Minds has the same thing. We're in communities as well, but we started on college campuses. And so the story is that our founder and CEO now, Allison Melman, she was a college student when her brother died by suicide, and he was also a college student. He went to Columbia and she went to the University of Pennsylvania, and they had no idea that anything was wrong. They knew he was struggling a bit with depression and things, but they had no idea how like severe it was until he passed away. And so through her grief, Allison decided to start a student organization on her campus for combating the stigma around mental health. And that was, again, back in 2003. So that was the big topic, was combating stigma. And now in its 22nd year, Active Minds has really evolved in the space to becoming an advocacy organization that really, again, mobilizes students to make the changes that they want to see on their campus through just different sorts of empowered leadership programs and our chapter network model. So I'll get it all into that in a little bit. But for your benefits and talking about Mental Health 101 and some information, I wanted to start with a definition of mental health. And Active Minds has agreed as an organization to use mental health definition from WHO. So it's the World Health Organization. And they say that mental health is a state of mental well-being that enables people to cope with the stress of life, realize their abilities, learn well, and work well and contribute to their community. However, my personal favorite way to think about mental health or define mental health is using this lovely dual continuum you see on the side. And I'm trying not to make this too much like class, but I promise, bear with me and you will learn something right now. And again, this is after years in the mental health promotion field. I stand by Dr. Keys's dual continuum over here. So if you look at this continuum, you can see that there's this horizontal axis that says high mental illness to low mental illness. That axis, I believe, is what we were thinking about as mental health for a really long time, almost up until the pandemic. I think most of our culture was like, mental health, you have an illness or a condition or you don't. And if you don't, it's not really something you need to worry about. But we don't think about physical health like that, do we? Because if you don't have the flu or you don't have a terminal illness of some sort, you still need to go to the gym and exercise. You should probably still eat nutritious meals. You should probably still get good sleep, right? When we think about physical health. Well, mental health is the same. And that's why Dr. Keys added this axis that is vertical, that is the flourishing to languishing axis of mental well-being. So it's kind of saying, all right, even if you don't have a mental illness, or if you do, your mental health can still languish to flourish on different days, weeks, months, years, depending on things that happen in your life. So maybe you're in a really hard class this semester and you just feel like you're really languishing mental health wise. Maybe you're a senior and you just got into graduate school or found out you got a new job and there's a lot of hope, right, that you have. Maybe you're flourishing at the moment. Maybe you just went through a breakup and you're feeling really down and you're languishing, right? It doesn't mean you have a mental health condition of any sort. It just means that your mental health is either languishing or flourishing at different points. And people that have diagnosable mental illnesses can also languish and flourish because of these things too, apart from the mental health condition that they have, right? So this continuum helps to identify mental health as a holistic type of well-being instead of this like, oh, I think I have depression, I should go to therapy. Again, valid, but there's just so much more to to the story here, right? When we think about mental health. So let's talk about some statistics of why should you care about all of this, right? Well, one reason I'm going to sell you on why you should care is that 39% of students in college will experience a significant mental health issue during their time in college. And again, this can count as a mental health condition or a major languishing issue, right? So that might mean like the death of a loved one or a very big transition issue, right? Or something going on where your mental health is languishing. But that's 39% reported this. Additionally, this really backs why Active Minds is building a mental health movement among youth and young adults. Part of this, I know there's a lot on this slide, but some things that stick out to me would be that, 60 million people experience mental illness each year in the United States, and 30% of youth and young adults have a diagnosable mental health condition. We know that there's a 2 times increase in the number of college students with one or more mental health problems from 2013 to 2021. So mental health issues are on the rise, and that's something that we need to, keep in mind and keep mental health at the forefront of the conversation, especially in colleges. A couple more statistics to think about. So in mental health, among college students, there are 2 main sources of data. The Healthy Mind Study and the National College Health Assessment are the 2 places you can get data on mental health. These are national organizations that gather data on student wellness and mental health. So if you ever need any data, go there. And your campuses probably gather data for one or both of these organizations. And their 2024 data, some stuff really sticks out. I think knowing that 77% of US college students reported in 2024 that their mental or emotional health was hurting their academic performance is a big deal. We also know that 66% of US college students reported feeling isolated from other people, which I think gives a lot of backing to the Surgeon General's call of an epidemic of loneliness among young people that he called back in 2023. We also have data telling us that 49% of US college students felt that health and well-being was not a priority of their college. And that's not good, because I think it is a big priority of many colleges and universities, but that's not coming through to almost half of US college students. And then we have this really sad statistic at the bottom that a quarter of US college students reported having suicidal behaviors in 2024. So we have a lot of concerning data here from both studies. Additionally, sorry, this is a little blurry. I think a lot of times if you were to ask people, or if I were to ask in the chat, why do you think people drop or stop out of college? Like, why do you think people drop out of school? A lot of people would probably answer finances or difficult coursework, right? We can see from this Gallup study in 2024 that emotional stress and personal mental health reasons were the top 2 reasons students were dropping out of college or stopping out of college. And so this makes mental health not just an issue, a life issue, right? I think we think of it as a life issue when we think about suicide, but then when we get to these non-crisis situations that are like, okay, I'm not feeling suicidal, but I'm still struggling, right? Mental health in the college space is a retention issue. It is an issue of students either finishing their education or not finishing their education. And it is really the responsibility of the colleges and universities to retain the students that they accept, right, for the 2 or 4 years that they have agreed to retain them. And so we have to look at mental health and increase mental health services and programming on campuses. So what are we covering today? Now that I hope that you are honed in and care about what I have to say about mental health, what are we going to cover? We're covering 3 things. We're going to cover self-care, and we're talk a little bit about your responsibility to your own mental health and how can you care for your own mental well-being, whether you have a mental health condition issue or not. This is just a general stuff to take away. The second thing we're going to do is talk about helping a friend. how can you help a friend in a non-crisis situation? So we're not talking about suicide or self-harm or anything like that. Those are separate trainings you can sign up for from different organizations. We're just doing basic, how do you help a friend with mental health? And then the third thing we're going to talk about is mental health advocacy on your campus and what that looks like. So let's start with self-care. So I want everyone to just indulge me for a minute and let's just do 1 minute. And if you wouldn't mind taking out either a sheet of paper, your phone, the notes app, does wonders. Anything you have to write with you or type with you, maybe a Word document on your screen, and write out your to-do list for this week in whichever way works best for you. I'm going to give you a minute to do that. Just write out your to-do list. All right, I'm going to ask everyone to come back for a minute as you got to just dump out your to-do list and the things you have on your list. Does anyone want to share in the chat anything on their to-do list for this week? Homework. I had a feeling that would be on there for the college students. Okay, class, just going to class. Big commitment. Going to the doctor. Okay. Working on Valentine's Day for an office party. Nice. Scholarship applications are due. Yes. Okay. See, these are some big things, and these are well-rounded things too. We've got some academic stuff. We've got some personal, physical health care stuff. We've got kind of some work stuff. We've got financial stuff with scholarships, right? So a lot of different stuff going on. So hold on to your to-do list for a second. I'm going to bring it back in a minute here. And I'm going to see if this can play from here. But if it can't, I'm going to go out to YouTube and watch this short video.
Once upon a time, in a small town, there was a very strong woodcutter who didn't have a job. So the woodcutter decided to ask for a job in a timber merchant, and he got it. The pay was really good, and so was the work condition. For those reasons, the woodcutter was determined to do his best. His boss gave him an axe and showed him the area where he was supposed to work. The first day, the woodcutter brought 18 trees. He was very excited. "Congratulations," the boss said. "Go on that way." Very motivated by the boss's words, the woodcutter tried harder the next day, but he could only bring 15 trees. The third day, he tried even harder, but he could only bring in 10 trees. Day after day, he was bringing less and less trees. I must be losing my strength, the woodcutter thought. He went to the boss and apologized, saying that he could not understand what was going on. The boss asked, "When was the last time you sharpened your axe?" "Sharpen? I had no time to sharpen my axe. I have been very busy trying to cut trees." Moral of the story? Our lives are like that. We sometimes get so busy that we don't take time to sharpen the axe. In today's world, It seems that everyone is busier than ever, but less happier than ever. Why is that? Could it be that we have forgotten how to stay sharp? There is nothing wrong with activity and hard work, but we should not get so busy that we neglect the truly important things in life, like our personal life, taking time to get close to our Creator, giving more time for our family, taking time to read, etc. We all need time to relax, to think and meditate, to learn and grow. If we don't take the time to sharpen the axe, we will become dull and lose our effectiveness. Sharpen the axe. Always.
The rest of the video, he's just going to ask you to subscribe.
Once upon a
And I think it's getting
time.
over. We'll go to the next. There we go. Okay. So this idea of sharpening the axe comes from the book, The 7 Habits of Highly Effective People. Has anyone read that book before? No, it's a very, very old book. It's one of my personal favorites, and it's probably one of the best self-help books of all time that has also stood the test of time. So if you're looking for a new book to read, if you want to dabble in the self-help genre, I would highly recommend The Seven Habits of Highly Effective People. Oh, and someone has the book. That's great. I think one of my favorite parts about the book as a mental health advocate myself was the fact the 7th habit is called sharpening the saw. And the definition that Covey gives in the book is about self-care and how he says it's sharpening the saw is preserving and enhancing the greatest asset you have, which is you. The practice of regularly investing time in renewing and balancing the dimensions of your life, physical, mental, social, emotional, and spiritual, to maintain long-term effectiveness and prevent burnout. And he gives all this advice throughout the book. You know, he has these 6 habits leading up to the 7th one that are saying, hey, begin with the end in mind, and put the first things first, right? And all this good advice. And then he says at the end, hey, you can't do all of this if you don't take care of yourself, if you don't sharpen the axe, right? Like in the story of the woodcutter, if you have a dull axe, you're not going to be able to do your best. You're going to be doing everything at 50% or 70% or even maybe 30%, right? Because you're not taking care of yourself. You're not recharging. And that's why self-care is so important. And although it can fall low on our priority list, the other things that are on our list may not get accomplished as well as they could or at all if we don't prioritize taking care of ourselves at the right times. So I would love in the chat for y'all to share how you practice self-care. What are some of your favorite ways to sharpen the axe? Yoga in the morning. That's awesome. Spending time with friends. Yes, friends are a great way to practice self-care for sure. Spending time with pets, another great way for self-care. Yes. Water and yep, water, diet, sleep. Yes. And I think those things like water, diet, and sleep can sometimes get a rep of as being a little like mundane. And so we don't think of those things as self-care, but they are. Drinking enough water, eating well, and sleeping are great forms of self-care. It doesn't always have to be extravagant, getting like going to the spa and getting a bubble bath, right? Sometimes just cooking yourself a nice meal is self-care. Go in nature. Yes, great way to clear your mind, great self-care, get outside, and cooking your favorite food. There you go. Gym and our favorite doom scrolling, which will probably be the word of 2025. Watch in a year, that will be the word that they have. So what I want you to do now is look back at your to-do list for the week. I want you to do 2 things. First, look at the things on your list and see if any of those things are actually self-care. Going to the doctor, I think, is a form of self-care. Again, it might be a little more maintenance self-care, but it is. If anything you listed is self-care, and if it's not, add one thing to your to-do list this week that is a form of self-care, because it's going to help you get everything else done on that list that you need to get done. Some ideas that you could add to your list could be clean your living space. Cleaning your room or your apartment or your dorm, whatever it might be, can be such a great way to care for yourself and the things around you, right? Clear your mind. Cook yourself a healthy meal. Set aside some time to either to cook yourself a healthy meal or go get yourself your favorite healthy meal on campus if you are somebody that has a meal plan. You could make a gratitude list or write somebody a thank you card. That's a great form of self-care. Meditate, exercise, call a friend or spend time with friends like Taylor pointed out in the chat. Take a nap or go to bed early. Prioritize sleep for one day this week and see how that goes for you. So add things to your to-do list. Did anyone add anything to their to-do list? If they want to shout it out in the chat, what they added? Clean your space. Good job. Bake cookies. Love it. Love that. And everyone's liking baking cookies. Maybe I can assume that 4 more people are also going to bake cookies this week, which is a great form of self-care. Get coffee with your mom. Yep. Connecting with friends and family. Great things. Whoever said yoga, adding that to mine. Awesome. See, we're inspiring each other here. This is great. Eat early and then go to sleep earlier. Yes, yes, wonderful. Yep, going to sleep a little early is a great form of self-care. Getting more sleep is wonderful because sleep really affects everything. It affects your perspective, your outlook on life. It affects your memory and how well you can academically learn and memorize things and retain information. It affects your mood. It can affect how hungry you are. Sleep really does affect so much. So doing that yourself a solid and just getting a little more sleep if you can, even one night a week, is a great idea. So my first resource I'm going to show you from Active Minds that may be helpful is our Your Voice is Your Power Resource Hub. This is just a hub of resources, as it says. I wish I had a better way to describe it. Online, where we just have a lot of, I would say, self-care ideas. And the hub is more focused on advocacy, but we have the hub separated out into self-advocacy, school advocacy, community advocacy. And the self-advocacy section is a lot about self-care because self-care is a form of advocacy for oneself, right? And so on the hub, if you click or you scan this QR code, you can find resources for all these types of advocacy, including some great self-care resources and reflections you can do either with yourself or with your CKI chapter too. If you want to have any resources for a meeting or something like that, where you do some self-care activities for free online, Active Minds website, you can download all of these. Part 2, helping a friend. We are going to talk about helping a friend in the context of a mental health situation. So, Active Minds, we have an acronym for helping a friend. It's called ASK, okay? And that's a great acronym because ASK, I think, is relevant to the topic. It stands for Acknowledge, Support, Keep in Touch. And these are the 3 steps we have coined the stop, drop, and roll of emotional support. So when you acknowledge someone's feelings, the first step, so let's say, well, let me back up. Let's say someone comes to me with a mental health situation of some sort. And again, this is a non-crisis situation. This is somebody's coming to me and saying, I think I just failed a test and I feel like such a loser. I think my boyfriend's going to dump me and I feel like no one wants me. I'm going to be alone forever. I feel like I'm never going to be enough for my parents, right? These things that are so common to feel, especially as a college student, when things in your life aren't going the way you maybe want them to, can be mental health situations, right? And we have so many college students saying, hey, I want to help my friends when they're going through a mental health situation. But we know from a survey Active Minds did with MTV actually 2 years ago that I think it was around 70% of young adults reported they don't know how to help a friend when they're in a mental health situation. And so that's why we created Ask. So if a friend's in that situation, we start with acknowledge. That's letting them know that their feelings and experiences are valid and that you believe them and recognize the courage it took for them to come to you, right? So it's saying, hey, yeah, it makes sense why you feel that way. Like, I'm so sorry you feel that way. Just acknowledging that the feelings are there and saying, thanks for telling me. That's a big thing to share. And I'm so glad you shared it with me, right? So being grateful that they're confiding in you. The next step is support. So this is just ask how you can help, right? Say, how can I be supportive in this situation? You could offer options for them. You could offer resources. You could tell them about professional help options if you think the situation warrants it. Or you could just, be a good friend and say, hey, would you, what would be a way I can support you? Would it be calling you tomorrow? Would it be going on a walk this weekend, and talking more? What does that look like? And so that comes to the third step is keep in touch. We've heard from our young adults that so many of these conversations can sometimes feel like a one and done thing. And then they feel like the conversation wasn't genuine because they never hear from the person again, or they never talk about the thing that they had a lot of courage to bring up again. So keeping in touch is a super big thing. If they said support looks like a check-in phone call, then call them. Call them the next week, call them the next day, and check in with them regularly and show them that you care about them and that you're actually here for them. So again, just to reiterate, when should you use the ASK acronym? This is for non-crisis situations, for conversations with friends where you are feeling that you need to provide some sort of emotional support, right? And you can share Ask with your friends in a lot of different ways, and you can share them with anyone, okay? This Ask is made for everybody. It's a free tool. It's a free acronym. It's not just for CKI people or Active Minds partners or anything. It's really meant to be shared with any youth or young adults. And so here are just some, again, examples of the Acknowledge, Support, Keep in Touch acronym. You could say, what a frustrating situation. That sounds really difficult. I'm here for you. You're not alone. Let's get coffee on Friday. Let's FaceTime tomorrow after class. Right? These are different kind of examples of what keeping in touch, supporting somebody, and acknowledging somebody's feelings can all look like. So we actually have two ways that you can dive deeper into this acronym of ASK and either learn more or share it with your friends or your CKI chapter. The first is an interactive, choose your own adventure style YouTube video that allows you to practice ASK while helping Charlie decide how to navigate a conversation with a friend. So has anyone done this on Netflix where there's kind of like a choose your own adventure video? You're like the character, and then you're like, I want her to go to the mall next, and then like the TV show actually follows. Yeah, it's kind of like Black Mirror, but there's actually a different one on Netflix where you can actually choose what the person does, and then they do what you say to do, and the TV show literally ends differently based on what you have the person do. So that's what the Ask YouTube video is like. You're actually Charlie, and you are choosing how to respond to somebody that you know. It's not really a friend of yours, but it's a girl you know named Luna. You see her at a coffee shop near campus, and she's applying for jobs, and she's just not having any luck scoring a job, and she's feeling really down. And you choose how to respond, and you kind of get different responses from Luna based on how you what you say to her. So you can go through Ask with your chapter by yourself and kind of learn what how people respond to different things and what brings out vulnerability and trust and what shuts people down, right? And then we have an interactive scrollable website that provides a deeper dive into Ask with activities, tips, and social media downloads for Ask. So if you want a deeper dive on a little bit more emotional intelligence sort of information, or understanding, what support resources look like nationally and on a lot of campuses, you can dive into the Ask website. So if you want to try Ask, here's the QR code. It is, again, a free resource. It's on YouTube, and it If you scan this QR code, it will pop up on YouTube. But just save it for after this presentation. Try it out, see how it goes. And it's something you can do with the students at a CKI meeting if you want to go through Ask. It takes like 5 minutes. So it's really short and simple and to the point, but you can do a deeper dive on the website if you're interested. So part 3, the final part, mental health advocacy. Okay, so I think I have to escape the presentation for this one and actually go to YouTube. So bear with me. Can everyone see? All right.
Imagine a warm, sunny afternoon. Suddenly, you spot someone in the river being swept downstream and struggling to stay afloat. Without hesitation, you jump into the river and help the person to shore. As you help that person dry off, you hear another cry for help. Someone else is being swept downstream. Immediately, you jump into the water again and pull out this second person. This scenario continues all afternoon. As you pull someone safely to land, you have to jump back in and save someone else. Finally, you say, "I can't go on like this," and walk upstream to see what's happening. As you walk upstream, you warn other bystanders. "People are falling in the river. Please help them. Tell everyone you know." Finally, you find the problem. You notice a large hole in a bridge which is causing people to fall in. Something must be done. First, you put up a sign to warn others about the hole in the bridge. You warn anyone you see about the hole and ask them to help spread the word of caution. You even start offering classes to help people in the community learn how to swim, just in case they do fall in. Finally, you realize that to truly minimize the problem, you have to repair the bridge. You work with others in the community to close the hole. Occasionally, some people still fall in, but there are far fewer people that need to be saved.
Okay, back to the presentation. Bear with me. Awesome. Okay, so that video really demonstrates the idea of advocacy and changing the systems around any sort of health issue, but for our case, mental health, right? Where sometimes things like Ask are really relevant. You have a friend who's struggling and you're going to pull them out of the river, right? And you're going to talk to them and say, okay, what's going on? How can I help you not drown in this river? How can I get you out of the river? But if you notice that a lot of people on your campus are struggling and falling down this river, it might be good to ask why. Are there enough mental health programs on your campus? Are there counseling center services available? Is there group therapy available? Is there a psychiatrist available? Does the culture on your campus really support positive mental health and not stigma around mental health? Or is your mental health really stigmatized on your campus or in different pockets of campus, whether that's in Greek life or in an extracurricular activity or in athletics? We have to look at kind of the causes of some of these things instead of always just helping one person. Again, helping peer-to-peer support is super important. I don't want to minimize that at all. But as mental health advocates, as we go into advocacy, we want to think about what are the problems with our systems, right? Especially on your own campus. So, the river analogy is many times used to teach people about something called the social determinants of health. Has anyone heard of the social determinants of health before? If you are a public health major, you definitely have. And everyone else, it could be hit or miss. Yes, yay. Okay, so some people have. These are non-medical factors that influence health outcomes. So this is not biological. This is not, anything that may be with anything you inherited or your person. This is things in your environment that are affecting your own health, okay? And the social determinants of health are the 5 following: economic stability, neighborhood and built environment, available health care, social and community context, and education. You can all see how a lot of these things, as you think about them, may influence how healthy you are or the health problems that you experience, right? Well, we've done a little bit of a deeper dive here at Active Minds, and we have come up with the social determinants of mental health on a college campus. Okay, so we're taking what we learned before, we're putting it in the context of mental health and on college campuses. So these determinants of mental health on college campuses include economic and financial support for students, the institution type. So are you at a community college? Are you at a four-year institution? Are you at a private school, a public school? Is your school in a rural community? Are you in an urban area? None is better than the other. It's just different, right? And then the physical environment, right? So is your campus really big? Is it really small? That just determines like the kind of resources that are available and also who gets the resources. And then we've got mental health, campus mental health services. What are the services available on your campus? How widespread are they? And how accessible are they to students? Finally, or not finally, next, you've got campus culture and climate, right? So that's going to be, what are the values and traditions at your school? So, we're talking to Taylor earlier. She goes to University of Alabama, right? There's a lot of traditions at the University of Alabama. And I used to work at Auburn, so just right across the way, and they had a whole creed that students learn. I don't know if anyone else's schools have creeds, but you learn a creed, right? And you have to think about, do the words in that creed, like what kind of culture do they make? Do they make a really collective, unified culture? That's great for mental health advocacy. Do they promote values that maybe aren't good for mental health advocacy? I don't know. It depends on kind of the culture of your school, right? And then climate refers to current things going on your campus. So who's the current student body on your campus and what do they care about? Some big climate things going on campuses over the past year were a lot of the protests for international conflicts, right? That really impacted the campus climate and how students were feeling on campus. So those all things impact mental health. And then finally, mental health education. What education around mental health is available at your school? Where can you go to learn about mental health at your school? And can you increase your knowledge around mental health, or are there just services available? Right. And so these things are all going to determine how many people are falling in the river. And again, you can teach, swim classes, you can do all the things, you can get people out of the river. But at the end of the day, it's really fixing the bridge that's going to lessen the amount of people experiencing mental health issues in your community. So some ways to do this. I've got 2 slides left here, so we'll be wrapping up in just a minute. Our Active Minds chapter network. So as I asked at the beginning, hey, does your school have an Active Minds chapter? Our chapters are clubs on campus, just like CKI, that have a mission of educating, advocating, and raising awareness around mental health. They normalize and destigmatize mental health topics and conversations, and they foster community and peer-to-peer conversation and connection among students and on campus. There are over 500 Active Minds chapters across the US and Canada, at different schools across both of those countries. And so I would really ask you all to think about partnering with your Campus Active Minds chapter, if you have one, on any sort of advocacy work they might be trying to do, and really think about how CKI and Active Minds can build that bridge together so less people fall in the river. And then finally, we have a new opportunity that I'm leading at Active Minds called the Mental Health Advocacy Institute. And this is a yearly opportunity that starts in the fall and goes through the spring, where you are paid as just an individual person, whether you're an Active Minds or not. CKI students can do it, where you develop a mental health advocacy action plan for your campus on addressing a specific mental health issue that you see happening at your school. And then you come up with a strategy to address it. You may not fix it, but you're addressing it, right? And so you take the first semester to develop and prepare a mental health plan. And the second semester, you implement it with the guidance of the Active Mind staff and the cohort of students around you. And so we will be accepting new applications late this summer, probably early this fall, for our 2025 cohort. If you have any sort of interest in mental health advocacy, or if you know a friend who this is really their passion, please refer them to us. So myself and my colleague Brett are over community fundraising, and I'm over higher education. So if you need to connect or want to connect with anyone at Active Minds, we would be the two people to reach out to who work with Josh and co at CKI, and we'd love to hear from you. So thank you for everything today. Feel free to ask any questions in the chat or out loud if you have any. Thanks, Josh. Any questions on anything? Yeah, of course. You're welcome. See that in the chat. Thank you.
Any questions?
As people are, thinking about it, I just wanted to say a few things. First of all, I'm Josh, everybody. I'm the CKI manager director. If you don't know me, but thanks for being here. And I would just second what Marky said about Active Minds chapters on campuses across really North America. And I know that we've got some other international clubs on the call tonight too. But for those of you in North America, like, it would be such a great opportunity to look into whether you've got an Active Minds chapter on your campus. And it's a great partnership to have at that club level, because we already have that relationship at the international level. So we're still trying to figure out how we can really make sure that those bonds are even stronger, so that we can, like, as Marky said, repair that bridge together.
Yes. Thank you, Josh. I see Andrew has a question in the chat. Have you ever had a situation where the ask framework doesn't work? That's a good question. So we actually had an old acronym called VAR, stands for Validate, Appreciate, Refer. That was before ask. And we did an update on it. We did some research on what students thought about the acronym, how it was landing with them, and what they wanted in a peer support tool. And that's actually how we came up with ask. They wanted something a little easier to remember. They wanted a digital version they could learn on their own instead of going to a training. And they wanted the keep in touch component to be a key part of the acronym, not just what you can do in the conversation, but how do you have a long-standing relationship when someone's going through a tough time, and how important that keep in touch piece is. And so I think I know you're probably thinking, oh, like, was there a certain situation this might not work for? And besides the kind of situations I've already highlighted of like, hey, do not use this for a crisis situation, like i.e. suicide or self-harm, there are other acronyms and other trainings you can take to learn how to respond to those things. So don't use ask for that. But for non-crisis situations, we just revamped this. And so we're excited to see how it's working, and we've heard great feedback from students. So we're hoping that it can work for a lot of situations you'll see around emotional support. Any other questions? Thanks, Andrew. All right, well, then I can end our time today. I know it's a little over with the Q&A. I appreciate that so much, Josh, in the chat there. Always good to end with some resources as well. And again, would love to hear from any of you at any time, even if it's a year after this call. If you remember Active Minds and you're interested, feel free to reach out.
Well, Marky, thank you so much for joining us and for teaching us all about Active Minds and ways that we can help our friends and those in our community. We really appreciate you hopping on tonight.
Thank you. Thanks for having me, everyone. Take care.
Thank you again, Marky. We are going to go ahead and play a Kahoot game that Sam, Dee, and Kelly, who are respectively the Member Experience Committee Chair and the Member Experience Vice Chair, are going to be leading for all of us. So Sam and Kelly, I will go ahead and let you all take it away, but this is the game pin for you all to join our Kahoot.
Thank you, Madison. All right, so hello everyone. For those that do not know me, my name is Samuel Zhang, and I'm the International Member Experience Chair. And to close off this webinar, we will be doing a Kahoot, and basically it's just going to be like little fun riddles. Some are going to be easy, some are going to be trickier. So we'll give everyone like couple of seconds to join.
Also, don't forget, if you stay for the Kahoot, you'll get to see the QR code for the survey after this, and then you'll be entered into a drawing to win a Kiwanis store gift card. So make sure you stick with the Kahoot, and then we'll show you that QR code.
Okay, Sam, we'll go ahead and get started, and we can put the game pin in the chat as well in case anybody wants to join us after we get started.
All right, so for our first question, it is, I am full of holes, but can still hold water. What am I? And the answer was a sponge. Our second question, what can fill up a room but takes up no space? That was a little tricky, but the answer was light.
Who's in the lead? Okay, Anya's in the lead. Right behind her, Amber and Jonathan. All right, come on. Y'all pick it up.
All right. I have cities, but no houses, forests, but no trees, and water, but no fish. What am I? And the answer was a map.
Anya's still in the lead, but Amber or Jonathan just passed Amber. Oh shoot, y'all look out.
You throw away the outside, eat the inside, and throw away the inside. What am I? And the answer was corn on the cob. And there was a slight shift in rankings.
Amber is no longer on the board. Y'all took her out.
All right, so the next question is, during what month do people sleep the least? And it's February. And Jonathan's now in first place.
Anya just got taken out. My goodness. Amber's back on the leaderboard.
The next question is, what disappears as soon as you say its name? And it's silence.
Leaderboard has not changed. Y'all better get it together.
Why did the king go to the dentist?
Ooh, that was
To
a
get
rough
a
one
new
for y'all.
crown. Yeah, that was a bit tricky.
All right, I bet you this moved. Ooh, Amber just went all the way to the top. She took out Jonathan. Y'all better look out.
So for our next sorry. For our next question, what is the difference between yesterday and tomorrow? And it's today.
Okay, Soup's on the leaderboard.
What kind of room has no doors or windows? And it's a
Yes.
mushroom.
Leaderboard has not changed. Come on, y'all, get it together. You're running out of questions.
If you have me, you want to share with me. If you share me, you haven't gotten me. What am I? And it's a secret.
Oh, still the same. Y'all gotta be quicker than that.
I repeat only the last word you say. The more I repeat, the softer I get. I cannot be seen, but can be heard. What am I? And the answer is an echo.
Y'all really were quicker with that one. What happened to the leaderboard? Nothing. Okay. Y'all got 3 more questions.
So next question is, which clock works the best? The one that loses a minute a day or the one that doesn't work at all?
I don't even know this one.
Do not overthink it. And it's the one that loses minutes each day.
Who got that right? Show yourself. Who got that right? That's impressive. Probably Amber. She's still in the lead. Oh, Brianna, that was you. So proud.
What can you catch but cannot throw? This one's pretty straightforward.
Honestly, Brianna should have gone to the top getting that one right. Honestly.
And the answer was a cold.
Ooh, leaderboard's still the same. Last question to change your fate.
I have a neck, but I don't have a head, and I wear a cap. What am I? And the answer was a bottle.
Look at y'all all getting the last one right.
And that was it. So in third place, we have Jonathan. In second place, we have Maddie. And in first place, drum roll,
Did someone take Amber out?
Amber.
Okay.
All right. Thanks everyone for playing this Kahoot.
Thanks, Sam. So before y'all hop off, we've got 2 QR codes to show you. Madison, if you'll whip up those slides. Ramesha, I don't know how you say your name, but that's my attitude right now as well. Like, woo! Exciting. Yes, Josh said Amber is the destroyer of cahoots. Yes, she is. Okay, so this is the survey you all been waiting for, but don't leave just yet. Fill this out. Go ahead and go ahead and scan this, then open up a different tab in your browser, and we'll scan the other one in just a second, okay? The next one is a sign up for the virtual escape room on March 4th that you guys have to be there. It's going to be a lot of fun. Amber and Srishti spent a lot of time putting it together. I went through the clues. I am so excited to watch y'all play. So definitely be there for that. So is everyone good with this survey QR code before we go on to the next QR code? Okay. This is the registration for the virtual escape room. Again, it's March 4th. Be there, be square. You got to be there. It's going to be so fun. So, but once you're done with that, that is all we have for tonight. So thank you all so much for coming on, and we really appreciate it. And it was good to get to learn with you all and play Kahoot with you all, but we will see you at the next event. So stay tuned.